Hi guys, thank you again. This is the Community College of Baltimore County's School of Health Professions. I appreciate you tuning in. I'm Ebony Thomas Butler. I do want to remind you to subscribe, to click the like button, and I'm going to ask you for a quick favor. Go down below and tell me the type of things you'd like to have in the next video. Today I'd like to introduce to you Amy Flagler. She is the program director for our newest School of Health Professions program. It's the Surgical Technologists program here at CCBC. She's got a lot of great things to help you out and to say to you. So thanks again and stay tuned.
Surgical technologists work at area hospitals in the operating room, as well as surgical centers or outpatient facilities, as well as doctors' offices. Surgical technologists are responsible for creating and maintaining the sterile field throughout the surgical procedure. We are also responsible for handing surgical instruments to the surgeon during the procedure, as well as maintaining any instruments and supplies so they're not left inside the patient. A skill set to be successful as a surgical technologist would be somebody who's dedicated, motivated, and is going to come back each and every day. Some days are harder than others because we are dealing with humans and life things which don't always go as planned, but you want to remain flexible and committed to the patient, as well as ensuring that you're providing the best patient care at all times. Our main location here at the Community College of Baltimore County on the Essex campus is in the Eustis building. We do probably 80% of our coursework here, and then the final semester students are actually in an operating room with a preceptor performing surgeries on patients. And we can go to any area hospital within the Maryland, DC, Virginia, Pennsylvania area. The prerequisites for this program include medical terminology, anatomy and physiology, math, and English 101. After admissions, the program is 2 years. We go in fall and spring for both years. We have 2 classes that are online and the rest will be in person. This is a hands-on profession, so we really need to do things in person. Some of the surgeries I've participated in as a surgical technologist include orthopedic surgery, which is joint replacements, as well as general surgery, GYN, ENT, basically anything on the human body we're going to potentially have problems with, we could do surgery on. Some of the most exciting memories of surgeries I have, I'd say, is the time that I was able to actually hold a beating heart in my hand. That was incredible, and to this day, probably the most exciting thing I've ever experienced. After that, the additional exciting thing, a surgeon let me drill a burr hole into the brain to get access to it, so that was really exciting as well. So even though we're doing the same surgery, for example, a lap chole, it's going to be different each day because the surgeon and patient will change. So I like having the same basic tasks that we're performing and responsible for, but then again, we have that variety each day so it does not get mundane. Surgical technologists start off at an hourly rate of $21 to $25 an hour, depending on certification. Performing in a surgical setting is high stakes and extremely rewarding. We're able to see in real time how we're able to help and impact this patient and their life. And it's very easy to forget how important our role as healthcare providers is to these patients. But being able to participate in surgery and handing the instruments to the surgeon, as well as holding retractors or digging in deep to try to get something out, it's very rewarding and very exciting to be a part of every day to see those immediate benefits of that patient.
Thank you, Amy. That was a fabulous interview. I hope you guys learned a little bit and that you're ready to apply. Remember to check the School of Health Professions website, ccbc.md.edu/shp. Check it on the regular basis. You can also email us at shpseat@ccbcmd.edu. Don't worry, I'll put that email below. Thanks again for tuning in.